Ice or heat? How do you know which one to use when you're injured? Heat usually feels better than ice, but you can't always rely on what feels good. We should follow the science of what cold does and what heat does on injured tissues. That's what I'm going to be talking about in today's edition of the Wellness Connection. If that sounds interesting to you, keep watching. Hi, I'm Dr. Mark LeMay. Welcome to another edition of the Wellness Connection. If you're new to our channel, we'd love for you to click on the subscribe button so that you're notified each time we release a new video, which is usually on Sunday or Monday. If you're already subscribed, thanks so much for being part of our community. We really appreciate it. Today we're talking about when you should use ice versus heat. Sounds simple, right? Unfortunately, it's not. If you choose the wrong one, you can end up in more pain. Okay, so let's start with the one that I use the most, ice. Why use ice? First off, we need to explain a phenomenon called the hunting response. This is a protective mechanism against undue cooling of any peripheral body part. When an area of the body is cooled, it reacts by first constricting the blood vessels for about 10 to 15 minutes. Then the blood vessels will dilate to protect that region from freezing. This gives your skin that reddish color. When you first get injured, the blood vessels dilate, releasing plasma and blood, causing internal bruising. This can go on for 48 to 72 hours and may lead to problems such as limited range of motion, noticeable swelling, and pain. Applying ice over the area will cause constriction of the blood vessels for a while and give you some temporary pain relief. Because of the hunting response, we know that after 15 minutes, these blood vessels will expand again. So you should typically use ice for 15 minutes. Now, when I say ice, I do not mean ice cubes. My favorite thing to use are these gel packs because they stay nice and flexible when cold. So let me show you how to use these. So what I like to do is I take a paper towel between my skin and the cold pack. So I'm going to put this on my neck because I'm going to do it up here. And then you take the cold pack, put it right over the top of that. And then if you take a towel, so you don't have to hang onto the cold ice pack, and you just hold it just like this. That's the proper way to use ice. The best way to use ice immediately after an injury is as follows. Ice the area for 15 minutes on and 15 minutes off for the first 90 minutes. In other words, you apply ice 3 separate times in 90 minutes. This will minimize complications by decreasing blood leakage and increasing the rate of absorption of unwanted fluids. After the first 90 minutes, ice should be used every hour for 15 minutes over the following 72 hours. After the acute phase is over, ice is still the treatment of choice because it increases the reabsorption of excess fluids into the cells, as well as increasing blood flow and the rate of tissue repair. We now want the hunting response to occur, so we leave the ice on for up to 20 minutes every hour. Many types of soft tissue injury can be helped by ice application, like muscle strains, joint sprains, immediate back pain after a sudden unguarded movement, and direct injury. Applying ice immediately after an injury has occurred is ideal, even before seeing your chiropractor. It will have an immediate pain relieving effect as well as encourage quicker healing. Now let's talk about when and why you want to use heat. Heat treatments should be used for chronic conditions to help relax and loosen tissues and to stimulate blood flow to an area. You can use heat treatments for conditions such as tight, sore muscles after workouts, or you can use this for warming up muscles before you work out. When I lived in Minnesota, I like to take hot baths after my workouts to help increase blood flow and to remove lactic acid from the muscles. This helped prevent muscle soreness the next day. It really worked well. The general rule is to use heat for only 15 minutes per application. This prevents excessive swelling of the tissues. My favorite form of heat is to use a rice pack. This one is made of denim with 1 cup of white rice inside. These are extremely flexible, durable, and you can heat them up in a microwave. Well, there you have it, how and when to use ice and heat. I hope you found this information helpful. If so, give us a like and share this with someone you know who could use this information. And if you haven't already subscribed to our YouTube channel, please click on the subscription bell. I'm Dr. Mark LeMay. Thanks for watching.